Before we dive into what cardiac rehab is and why it's so important, let's first revisit the benefits that physical activity brings to your heart and cardiovascular system. Understanding these benefits helps us appreciate how cardiac rehab supports recovery and improves heart health after a cardiac event. So first we'll have a look at the benefits on cardiac output. So when you exercise, especially aerobic activity like walking, running, or cycling, your heart pumps more blood to supply your muscles with oxygen. So this happens because your heart beats faster, which pushes out more blood with each beat. It also has benefits on cardiac remodeling. So over time, regular exercise strengthens your heart muscle, which makes the heart chambers bigger and can help the heart to pump even more efficiently. This means that it can pump more blood with less effort even when you are at rest. And lastly, the vascular benefits. So exercise also helps to keep your blood vessels flexible and healthy. So as we age, blood vessels tend to stiffen, but staying active can actually prevent this. It also reduces inflammation and oxidative stress, which are harmful processes that can damage your vessels. Exercise also helps lower blood pressure by helping the blood vessels relax and widen, making it easier for blood to flow. So this means that regular exercise not only supports your heart to work better during activity, but it also helps to prevent heart disease in the long run. Next, we're looking at factors that affect your chance of developing cardiovascular disease or CVD. And these risk factors fall into two main groups. So the non-modifiable factors, these are the ones that are out of your hand and you can't control, and they include age, gender, family history, and ethnicity. So age is the biggest one, and your risk significantly rises as you get older, especially after the age of 65. Men generally face higher risks earlier in life, while women are somewhat protected by estrogen before menopause. However, after menopause, women are actually experiencing higher rates of CVD than men. Family history also plays a huge role. If close relatives had a CVD at a young age, especially before 55 for men and 65 years for females, your risk goes up considerably. And certain ethnicity groups like African American have a higher risk compared to others. So now for the good news. You've got the modifiable risk factors. These are the things that you can control and you can change through lifestyle modifications or medical treatment. These generally include smoking, excessive alcohol intake, high blood pressure, high cholesterol, obesity, and a lack of physical activity. Managing blood pressure through lifestyle medications, keeping a healthy weight, and staying active can dramatically cut your risk for CVD. For instance, abdominal fat is especially harmful, so maintaining a healthy waistline matters. Regular exercise not only lowers blood pressure and improves cholesterol, but it can be as effective as some medication in reducing heart disease risk. So in short, while we can't change factors like age, gender, or genetics, focusing on what we can control through diet, movement, and avoiding harmful habits gives us a powerful tool to protect our heart. So what is cardiac rehab? Cardiac rehab is a supervised program recommended for patients recovering from cardiac events. It helps you to recover and get back to your normal life after a heart attack, heart surgery, or being diagnosed with a heart condition like heart failure. Cardiac rehab generally consists of 4 phases, namely the inpatient, supervised outpatient, unsupervised rehab, and the long-term maintenance program. Studies show that cardiac rehab is safe, has a low risk of complications, and offers benefits such as improved cardiovascular function, reduced hospital admissions, and of course, a better quality of life. So why is all of this of importance? So in 2021, about 98,000 people died from cardiovascular diseases in South Africa. High blood pressure, a major risk factor for CVD, affects about 26.1% of women and 27.4% of men in South Africa. Tobacco smoking, which is another risk factor, was reported by 22.5% of the population in 2019. So what are the aims of cardiac rehabilitation? The aims are to reduce psychological and physiological stress placed on your body by cardiovascular diseases, to lower mortality risk, to prevent recurrent hospitalization, and to improve your cardiovascular function to enhance your quality of life. So achieving these goals strengthens your cardiac capacity, slows or reverses atherosclerotic disease progression, and it boosts your patient confidence through general conditioning. We'll look at some common reasons why someone might not be suitable for cardiac rehab or start the rehab process. This includes an unstable angina, resting systolic blood pressure more than 200, or diastolic blood pressure more than 110, severe or symptomatic aortic stenosis, uncontrolled atrial ventricular arrhythmias, or any musculoskeletal conditions that prevent adequate participation. Cardiac rehab is indicated for the following conditions: those recovering after recent heart attack or heart problems, managing symptoms in people with ongoing chest pain, which is also known as a stable angina, long-term management of adult congenital heart disease, to improve heart function in people with heart failure, and then lastly, to support recovery after heart surgeries like bypass, stents, transplants, or valve repairs. And then lastly, we'll discuss the different phases of cardiac rehab. So the first phase, which is the inpatient phase, occurs mainly during hospitalization, which involves daily consultations with your physiotherapists and dietitians. This focuses mainly on mobilization while also observing for any contraindications and precautions to exercise. The second phase is the supervised outpatient phase, which begins post-discharge and includes care from biokineticists, dietitians, and physiotherapists, and emphasizes monitored cardiovascular exercise and improvement in activities of daily living. The unsupervised phase lasts 3 to 6 months, mainly managed by the biokineticists, dietitians, and psychologists. They focus on gradual return to recreational activities with intermittent monitoring. And then the last phase, which is the long-term maintenance phase, primarily involves a biokinetics, with annual checkups required, which includes a stress ECG. This phase mainly aims to maintain cardiovascular fitness and manage any risk factors of cardiovascular disease.